that turns your device into a clinical quality ECG machine. So what you do to use it is I've got this case here on my Verizon iPhone 4, just off the shelf phone, and you just launch the app, and then you hold the device in your hands, screen to flip, and there you go. It's recording my lead 1 ECG in a couple seconds. Once it is able to learn my heart, it'll show my heart rate in the top right corner. Right now it's recording a 30-second trial. The blue bar at the top is counting 30 seconds. It stores the data on the phone as well as automatically wirelessly uploads it to the cloud where it's accessible by you or your physician from anywhere in the world within seconds. And this will be available a little bit later in 2012. We're currently pursuing our CE mark and FDA clearance, so once we have those CE mark, likely before FDA, will begin selling. And this will retail for under $100.
Wow, under $100. Now, what does lead 1 ECG mean as opposed to 6-lead ECG?
Yep, or so standard, multi-$1,000 GE machine does 12 leads. The lead 1 is the primary lead. Lead 1 is left arm minus right arm, so that's why I'm holding it in my hands right here. It's left arm minus right arm, and you can diagnose arrhythmias with this. Lead 1 is what's used on AEDs, defibrillators. It's what's used during triage to determine the cardiac condition of someone. It's not as in-depth as a 12-lead, so this is not replacing the 12-lead ECG system. It's more just supplementing it. This is something that patients can take home with them. And if they're feeling symptomatic, if they have a heart condition, they can pop this out, record their ECG, send it off to their physician within just a few seconds, and then their physician is able to diagnose what's going on.
What can be diagnosed with it, or what conditions would be useful for that you don't need the 12-lead for?
I'm not a cardiologist, I'm an engineer by training, so I can't specifically, I'm not entirely sure. I'm definitely cardiac arrhythmias, though we've done a clinical trial, a few clinical trials, but one of them at the University of Southern California, where we handed about 50 cases out to consumers that attended a conference, and we were able to diagnose several arrhythmias just by seeing the incoming data, the PDFs that were uploaded to our cloud of the data that was collected.